Hi, I'm Dr. Arshnoor from Dr. Arshnoor's OET Institute. Firstly, I thank you for liking my videos. Please keep on motivating me by liking and sharing my videos. If you haven't subscribed my channel yet, subscribe it right now to get the latest updates on my channel. In today's video, I'm going to discuss one crucial part of OET speaking, that is intelligibility. The purpose of this video is to guide you how to improve this criteria in OET speaking. Now let's see, what is intelligibility? It means your pronunciation should be clearly understood. That is, the words should be spoken accurately. Besides this, stress, rhythm and intonation that is used in the OET speaking should be in a proper manner. Above all, native accent does not have any negative effect on the listener. What does this mean? Usually the candidates try to adopt British or Australian accent. That looks very odd and artificial, so try to avoid it. You need to be original. Don't try to speak like foreign speakers, because speaking in the tone and accent of your area is not going to be deduct your scores. Let's go in more details. While having your exam, it is vital for you to pronounce words clearly. You have to understand vowel sound and consonant sound clearly. Besides this, how to stress correct word in a proper manner. This should be properly understood by you. Let's see some examples. Vowel sounds A, E, I, O, U usually sound like A, E, A. So, how it is spoken? For example, as we pronounce word carefully. So, care A. It has three vowels. It is A, E and U. So, all have their different sounds. In these three vowels, we use different sounds to pronounce. Similarly, exact, diarrhea, uncomfortable. So see how these vowels sound, and exactly you should copy and try to imitate this. Pitch and project your voice well. So this is the second criteria here. Speak with confidence. Avoid mumbling, slurring speech or going down or fading out at the end of the sentences. Use stress and intonation to emphasize meaning. It is worthy to note that he is allergic to penicillin, so don't give him penicillin. Okay, so this is an example to clarify this point. Now let's see, how can you improve your pronunciation? First, listen to English podcasts, listen to different vocabulary words and notice how to stress and speak. Keep an organized vocabulary notebook. You can write some difficult medical terms and record these words in your own voice. Then try to listen to right pronunciation of these words on internet. Use online dictionaries with sound files, speak words, repeat and practice. Try to find the exact sound online. It is easily available. In addition, you can talk to people around you in English. Ask them to correct you. You can have phonetical conversation with English speaking friends. It is important to self-assess yourself and make a list of the words which sounds that you feel are difficult or confusing for you. These are usually difficult to pronounce in your case. Select these words and practice these as much as you can in your free time. So you may use difficult medical words and practice on these properly, so that you should have a habit of speaking these words flawlessly. Now, next comes voice projection and pitch. It is significant to have loud and clear voice. so you can record your voice on your device and listen to it. Check if your voice is clear and understandable. Actually, your recording of the speaking test will be assessed by the experts, and according to that, you will be evaluated. Different people have different voices. Some have deep, free and hard voice. You have to self-evaluate it and check the rise and fall and smoothness of your voice. Listen to the range of your pitch. Listen to English videos, audios, and try to speak like that. It is important to check the flaws in your voice. For example, mumbling and slurring of voice. Sometimes it may be that you're missing some of the important sounds. Sometimes there is not clarity of your voice. You have to work on this. Compare your recordings with the material available online and check your voice flaws. Then try to correct your weaker areas. Copy the expert speakers to improve yourself. Now, I'm giving you a formula. Copy, repeat, compare, and repeat. This means you should practice as much as you can. Copy the expert English speakers, then you should repeat like them. Then compare your recording with them, and then again correct it and repeat it. So, by doing this exercise, you will start speaking flawlessly. Next comes intonation and word stress. Correct intonation gives good meaning to your speech. That means practice using rising intonation at the end of the question. That means asserting yes or no. Let's understand by an example. Would you be able to monitor your blood glucose level at home? Would it be okay for you? So we are asserting at the last part of the speech. While speaking, important part of the speech need to be stressed to draw attention. For example, it is mandatory for you to take your medicine properly. Don't skip even a single dose of your medicine. This means we are stressing the important part of this speech. That is, we are saying, we are giving an advice to the patient, we are giving an instruction to the patient. That is, it is mandatory for you. So we are asserting here to take your medicine properly. Don't skip even a single dose of your medicine. So it is important not to skip even a single dose of the medicine. Watch, listen to videos, audios related to medical consultations and noticing the variety of the expressions. It is important for you. A medical professional has to use variety of tones. For example, a softer tone of voice while showing empathy and a firm tone while convincing a reluctant patient. Let's see it by an example. I can understand how difficult it would be for you to take this decision. This is softer tone to clarify empathy. Now just see the firmer tone. But it is very important for you to sign the consent form before your daughter's surgery. So here the firm tone is used by either doctor or the nurse to get the consent form signed. Last comes sentence, rhythm and accent. While listening to medical podcasts and watching video clips, you can easily copy the rhythm in your speech, but it should be natural. It should not look odd. Usually what happens when the candidates, they listen to English videos, or clips or the audio podcasts, so they try to copy. That really look artificial and odd. Try to avoid it. An expert, an English teacher, or friend's feedback can be helpful for you to check your accent whether it is intelligible. Now I'm giving you few tips to improve your intelligibility. First, listen to English podcast. Watch English medical videos as much as you can. Second tip, try to find out the words that you feel difficult to pronounce or sounds that are difficult for you. Third, while listening to audios or podcasts, try to imitate intonation and rhythm. At last, the most important tip, that is, to practice as much as you can. Copy the English speaker, then repeat it. Then you should try to compare it and see your flaws. And again, after correction, you should repeat it. In this way, by practicing more and more, you will be able to improve yourself. Practice as much as you can. Thanks for watching this video. Like and share our videos and subscribe our channel for new updates. Happy learning. Stay connected.